Hi, I'm Lucky Jain. I'm currently the Richard Blumberg Professor of Pediatrics and Chairman of Pediatrics at Emory University in Atlanta. So premature birth is an extremely important cause of mortality and morbidity both in India and the rest of the world. In fact, between 10 and 15% of all babies born in the world are born early. And babies who are born early have a higher risk of dying or surviving with lifelong disabilities. In the US, the prematurity rate is roughly about 10%. In India, it varies a lot, going from one state to another. The lowest prematurity rate is in Kerala, and so is the infant mortality rate, which is much lower in Kerala as compared to some of the other states in India. But a large fraction of premature births occur at gestations like 34, 35, and 36 weeks, where there is great opportunity to improve outcomes. So you have to remember that premature birth is any baby that is born below 37 weeks. And most developed countries focus on babies that are born very early, whereas in countries like India, we need to focus on babies that are more mature but yet are born early. Absolutely. So as I mentioned, 75% of all premature births occur at 34, 35, or 36 weeks gestation. So you know the context, term gestation is 39 to 40 weeks. And so being born just a few weeks early can increase your risk of either death or lifelong disability. And in these populations, 34 to 36 weeks gestation, a large number of births occur because of either maternal conditions, the mother goes into preterm labor, or the mother ruptures her bag of water, leading to premature rupture of membranes. And so in all of these conditions, there is an opportunity to either prevent preterm birth, or if preterm birth is inevitable, to improve the outcome of the premature infant. One of the strategies that we are looking at currently is the role of antenatal betamethasone or antenatal steroids when given to the mother who comes in preterm labor. Now, below 34 weeks gestation, all preterm babies need to be exposed to antenatal steroids. And we strongly recommend that at all gestations, preterm gestations below 34 weeks, that the obstetrician consider giving the mother 2 doses of betamethasone or dexamethasone, whichever one is available, to help improve lung maturity and overall maturity of the baby. Right, so there are known low-cost interventions that are grossly underutilized in much of the developing world. One example is the use of folic acid, for example. Folic acid, when given in small doses before the mother becomes pregnant, has been shown to dramatically reduce the risk of birth defects and also can help impact prematurity and preeclampsia. Preeclampsia is a disease that occurs in pregnancy and often leads to early birth. In the US and many other countries, there has been a big push to add folic acid to food so that the fortified bread, for example, constantly provides the required amount of folic acid. There is no such program in India, and I wish that there was a program which would promote folic acid intake, because folic acid also prevents anemia. It's such a simple intervention. 2 things to remember regarding folic acid. One, it needs to be taken before the woman becomes pregnant. It has to be started months before and needs to be continued at least 3 months into the pregnancy. We recommend that mothers who are in the reproductive age group constantly take folic acid throughout their reproductive life. That's the simplest way of of making it effective. But in mothers who have had a birth defect in a baby, the dose of folic acid that is required is 10 times more. And so for that, there is a simple folic acid pill available through most PHCs that mothers can take. And that again can be taken lifelong. The second intervention that I talked about earlier is giving the mother antenatal steroids. And I think that that is something that needs to be practiced in every rural area, in every PHC where mothers should be allowed to gain access to antenatal steroids, because that helps improve the outcome of the premature baby. Right. So many years ago, there was very poor understanding of what fills the lungs of the fetus. Because remember, the fetus is in the uterus surrounded by a pool of fluid, and it's completely drowned in that fluid. And so the thought was that the lungs of the baby should be completely full of fluid. Indeed, they are. They're completely full of fluid, and that fluid needs to be cleared after birth so that normal air exchange can occur, and the dependence on placenta for oxygen and nutrients goes away. My research over the last 20 years has been focused on how the baby or the fetus clears the lung fluid. And so we have now focused on looking at what is the magic bullet at birth that Mother Nature or the good Lord has given us that allows the baby to do it, or what actually indicates to the mother or the baby that the time to be born has come and that the lung fluid clearance needs to start. One of the interventions that Mother Nature employs is steroids. And so the mother and the baby naturally secrete steroids right around the time of term delivery or when spontaneous labor occurs, and that helps with clearing of lung fluid. And in pregnancies where that advance notice is not available, we recommend giving mother antenatal steroids, and that seems to help tremendously. The second part of my own research is focused on looking at the outcomes of late preterm babies. These are babies born between 34 and 36 weeks gestation, and we have done a lot of work looking at why these babies, when they go to school, they begin to have problems, why there are learning disabilities, why there is autistic behavior, or why there are bigger neurologic problems like seizures, etc. And so there is a lot of opportunity to help there also. Oh my God, yes, of course. I have a very deep connection with India. I was born in India and grew up in Jaipur. I went to medical school in Jaipur, and many of my teachers are still around in India. We have contributed to the education through bringing a lot of people from India to the US and helping them get the same kind of education that I was lucky enough to get. And so my connection with India through organizations like Neonatology Forum, the Indian Academy of Pediatrics, and through general communication with a lot of senior people in India has been very strong over the years. And I very much appreciate the opportunity to continue to stay connected with pediatricians in India. Well, India has the largest number of babies born each year. So if you look at 120 million babies born in the world each year, 26 million are born in India. Compare that with only 4 million births in the United States. So India has a huge role to play in the global market, because every newborn has the potential to grow to 75 or 80 years of age and contribute to the growing workforce that India has delivered to the rest of the world. So newborn care is extremely important, even though it's been undervalued in the past. Imagine a mother takes care of its pregnancy for 9 years or 9 months, and for years there has been planning and doing things to improve outcomes, yet when the baby is born, for the few minutes, the golden minutes and the golden hours after birth, there is not often adequate care available, which leads to long-term consequences. So there is great importance of newborn care in India, and even though a lot of times adult issues take importance when politicians make decisions, newborn care is equally important or much more important, because every penny or every paisa spent on taking care of newborns multiplies many fold, because these babies have a long lifespan. In India, I see the tale of two cities. There is the neo-rich community that has access to a lot of good care. So good hospitals, access to the best medications of the world are there for people who can afford it. But there is a large number those numbers are left behind. People in rural communities, people in urban slums who don't get access to the same level of care. In those populations, you don't need high-tech care. You need simple interventions. You need somebody who can attend to the delivery, somebody who knows how to troubleshoot if the baby doesn't immediately breathe after birth, or if there are problems, or if there's an infection. Those kinds of things need to be taken care of, because they have, again, a much bigger impact on the outcome than providing high-dose multivitamins to an affluent family, because they are already replete in vitamins. It is the poor family that needs that small dose of folic acid that can help prevent birth defects. Well, India is a rising global force, not just commercially. India has the potential to rewrite healthcare delivery. And I feel very strongly that given the proper attention to public health approaches, India could become the trial ground for public health interventions that impact overall health outcomes. Some of them have already begun. You see public health schools all over India. When I was growing up in India 30 years ago, when I was in medical school, there were no public health schools. Now those approaches are beginning to be seen. They are also starting to experiment with mass projects. How do you take something like folic acid, or how do you take something that can impact prematurity across the spectrum of the Indian population and ultimately improve outcomes? Because that ultimately will leave a lasting impression, not only our generation, but on generations to come. Thank you very much.